I have seen one thing you have said that quickly you have to do. I have seen in your case. So I think you are the one to implement AI quickly, right, into both the hospital management system, patient management system, and also clinical systems. I can see that in your CV as well. You have an International Institute of Information Technology advanced certification in artificial intelligence and machine learning in 2021. Immediately after that, you have developed these products.
Yes. So I always want to do AI. Okay, it's a very interesting AI story. Okay, AI. When COVID started, also AI also kind of started.
Yeah.
Obviously AI was there for a long time, but machine learning as a concept started coming into the general. It first came into the business environment, and now it's coming to the consumer environment. But in the business environment, it started coming in a big way in around 2020, 21. And I always wanted to do. I was sure that this is the future of products of clinical research. AI is going to be the future. Okay, way back, and then I said that I told my team that we need to implement AI. Okay, we were scouting around for partners. We hired a resource, a senior resource who already worked for 5 to 7 years in AI, and we were trying to get him to build some tools. None of us were aware about what this whole AI thing is and what it does, correct? And so then I decided that I also need to do a course to understand what is AI, because otherwise I will not be able to understand what's happening. I'll not be able to implement, not be able to direct, push. None of those things would happen. So which is why I joined the Triple IT course in AI and machine learning, and I could see the benefit of that within like a few weeks. Okay, just like you told me your story about how you benefited greatly from learning I benefited greatly in less than 2 to 3 weeks. Okay, we had hired a company in Bombay who said it will take them 3 months and 25 lakhs to build Dacian trees for medical coding, AI in medical coding for our product.
ICD.
Not ICD, Medra coding.
Medra. Okay.
Okay, and we didn't know better. I said, yeah, maybe AI takes 3 months, and it maybe it does happen that way. But within 2 to 3 weeks, I figured out the task which they're talking about doesn't take more than 2 hours. If you have the right tools, if you know what you're talking about, correct?
And this knowledge has come to you after you gone to that institute and know about the AI.
Yes, in 2 3 weeks, I got to know that that's all is about AI.
Yeah, but the background is this course you have done.
No, the course is, while doing the course, I figured out.
Okay, while doing the
3 weeks into the course, I figured out that what the company which was going to charge us that kind of money was going to do
in 2 hours.
It can be done in 2 hours, right? Just with the right set of tools and knowledge. Supervised versus unsupervised learning, Collab notebook, Jupyter notebook, all of that stuff, right? So all that was something which we did not know, and they knew. They held all the weapons, correct, and they could charge whatever they like because we had no knowledge, we were ignorant.
Yeah.
Okay. So I would say that within 2 weeks my course literally paid for itself. Right. So then we of course did not go ahead with them. We also fired that senior guy because we figured out he had no clue what he was doing. Okay. And then we looked at a different team who was actually working on AI. We built our first AI use case in 22, and then in 22, 23, ChatGPT launched.
Yeah.
Okay. And that kind of changed everything. It took us about 6 to 8 months to understand what LLMs are, what ChatGPT is, and then since then we've built a large number of use cases which are in production. Okay. Now we come to the next set of the whole where AI is today. Okay, AI is everywhere today.
Yeah.
But then where is AI in production? There are very few cases of AI in production, despite what people say, especially in our space, in life sciences space, because again, just like any other technology, this technology also will take time to mature, and that's what doesn't what the picture which these AI companies will give you, right? They sell you AI like you could actually use it tomorrow and become you can automate everything, but that's not the case, right? And that's a completely different story.
Yeah, many companies are on back step saying basically they are not using AI. It is just for namesake. I have seen many companies, they don't have any idea what is AI, but on the marketing side they use AI, right? But I have seen one of your conference where it says real AI, real impact. Yeah,
Yes.
yeah. Maybe these guys have done that real AI, real impact. So that was eye catching. So it assures that to the customers you are using real AI, not faking AI.
Exactly
Yeah,
what you said is that there are too many people who are claiming to be doing
yeah,
AI.
yeah.
Correct. Whereas we are actually using AI, we've been doing it for like 4 5 years. So we wanted to make that distinction, saying that I mean we are not claiming, we are actually doing it, which is where the whole real AI, real impact came.
Yeah, that was catchy.
Thank you.
Yeah, yeah. How do you figure out in a particular product, any product you take, where AI can help? So how do you figure out that?
Interesting question. And um,
One more thing, if you invest in the wrong direction, right, it will be waste of money.
completely.
Yeah. How do you pick
Yes.
up? I have the product, IRT or hospital, CRM, whatever the product, AI, WhatsApp chatbot,
I think this is
AI.
the best question of
Yeah,
the
yeah,
entire, because it really takes the crux of what you're trying to do with AI into question.
yeah.
And this is where we've had to learn the hard way. How do we invest correctly in AI? I mean, we've done a bunch of things in AI. We have a couple of products in the market, and we have done so many more things which are not available in the public domain because these are all failed experiments.
Right.
Okay, so you're also trying to figure out which is the best place and best use case for AI, uh, and that's essentially a combination of the. It's also linked to the earlier question, is that how do you figure out which is the best product, right?
Yeah.
How do you figure out product fit, all that, right? So a lot of those principles actually should be taken over into AI. Okay, people look at product fit as being applicable for figuring out which is the best product to build, but the same principles need to be applied to AI as well, which is not what is happening today. Okay, it is a lot of times the larger companies who have money, it's pray and pray. Essentially, you're throwing money everywhere and hoping that some of that will stick and you will be able to get a product out. But that's not how it goes, because the understanding of AI itself is so limited that people today, I can build a POC in 3 months. I or most lot of people can build a POC in 3 months. But to be able to build a production quality AI tool takes 12 to 15 months,
Yeah, which is useful.
which is useful, which is
Yeah,
where I said production quality, because one, essentially what we're saying, that it's fit for purpose. It is, it is essentially what the customer would like to see. It is robust, it's validated, it's consistent, it gives the results, right? It's actually savings in time and money, which what is AI is supposed to do. To be able to do that, it takes anywhere between 12 to 15 months. But that's not what you hear in the market. What you hear in the market is 3 months, 6 months, and I have AI.
yeah,
But that's not how it goes. Because when you build AI as a POC, as a proof of concept, correct, you use a limited set of data. And subsequently, when you start moving to production data, you find that the AI model behaves completely differently. Okay,
not useful.
it's not at all consistent. It's not reliable. It's not robust. You're getting different results. To be able to stabilize that and to be able to build a consistent product is what really takes time and effort and money. Okay, so AI, you have to figure out that, when you take up a use case, you need to figure out that in the end result, that is, can this AI tool become stable or not, or am I trying to do something which AI is not capable of? I know that may sound like a, you know sound something which is contrary to what is happening today, but AI is actually not capable of everything.
Right, that's correct.
Right?
That everyone.
AI can't cook and clean your house. Okay,
Yeah.
people believe it can, but it cannot.
There are
Okay,
as of now, there are the limitations for AI as well.
there are limitations. There are lot of limitations for AI, but the popular perception is AI can do everything.
Everything, yeah.
But it's not. So which is where that sooner you get in, get your hands dirty,
Yeah.
understand the limitations, then you can take a call at that. Should I apply AI for this problem or not? Is it worth applying AI for that problem or not? Okay. The most common example of where AI can be used is wherever data is.
Yeah.
Okay, wherever documents are,
Maybe
wherever
especially for
information
reports.
is, right? Wherever reports are. Okay, reports also no, but I would largely say that wherever there's a lot of data involved, right? Where the humans are looking at data, trying to make decisions, AI is very good at that. Where documents need to be processed, AI is very good at that. Okay, where you want to do some image reading and all that in hundreds of documents, AI is very good at that. So stuff like that are the most common use cases. When you now start wanting to apply AI to more edge cases, more less common use cases, that is where the problem starts. Okay, where in which your expertise, patience, time, money, effort, all that comes.
Yeah, can you give us an use case for a particular example, any of the products where you think you have done the best job in this particular example to build AI, and in this particular example we have decided not to go with the AI, that is the best decision. Can you give me both examples?
Yeah, so one example is there's a tool which we have called AI data review.
AI data review.
Yeah.
Okay.
Okay, DM data review using AI.
Okay.
Okay. So what happens in this case is in clinical trials, data managers have to review the data and they have to look at if there are any discrepancies and raise queries on that data. Okay, and that's a very tedious job. It takes weeks and months because there's clinical trial data is large. Okay, you could have hundreds of patients, you could have millions of data points. Okay, so how do you figure out going through all of that data is a very challenging job, and today you have like a large teams of data managers doing just that. So what we did is we decided that this is a really good place to deploy AI because it's all about data. Okay, so data will actually go through the database. Will Data managers can actually write prompts. They can just ask for can you show me, give me a data set consisting of subjects, male subjects, 20 to 40 years old who reported this condition but who are not taking any medication.
Okay.
A simple prompt. So the system, the AI tool creates a data set. Data manager can review that and he can raise a query directly
Okay.
on the EDC right there. Today, that the same thing takes about a few days because the prompt what I talked about, that has to be done by the biostats team.
Statistician. Yeah.
Statisticians, he has to use SAS or R
SAS,
to
yeah.
generate the data set, give it to the DM. DM has to look at all that, figure out where the discrepancies are, log back into the EDC, go to each subject to that page, and then raise a query. So it's a very tedious job, and we kind of short circuited, really shortened the whole thing, and people are really liked what they did. So this is a very obvious, not obvious, I would say it's a very good use case. Okay, and this is a use case which is not being done by most people. So it took us some time and effort to arrive at this, to kind of finalize that, okay, this is what we want to do. Okay, it's not an obvious use case, but then it has its own challenges. Is that how do you convert a prompt, okay, a normal English prompt, to something in SQL so that it can pick the correct data from the database and show that and create the data set and show it to the user. Okay, that's not a normal thing which can be done, which needs a lot of effort. It needs programming and it's AI. So AI by itself in any application. So yeah, so if I want to go back into this whole thing, AI in application development is, I would say, about 20-30% AI, okay, and 70% application development, which is your regular .NET, Python, or it could be any Java, anything. Because if you want AI to work in isolation, it works, but it's of no use to anyone.
Right.
The best use case of AI is when it's sitting in your application, when interacting with data, it's able to pick up data, push back data, it's able to do all of that stuff.
Okay.
Right? And to be able to do that and do it consistently, make it work without any issues, okay, is what takes a lot of effort. Because remember, today AI, when I talk about AI, we are largely talking about LLMs, large language models,
Yeah.
Gen AI, generative AI.
Yeah.
And generative AI is susceptible to hallucination.
Right.
Susceptible to being not reliable. If I, one of the big problems is that because it's a probabilistic model, if I ask a question, right, and a lot of people don't know this, is that if I ask AI question, Gen AI question, okay, it cannot say I don't know.
Right.
It's not built into its DNA. It's not built into its programming. It has no concept of I don't know.
Okay.
Either it will not show any result, or okay, worse, right? And the it not showing results is reduced. The worst case is that it makes up something and shows it,
Okay.
or it shows you. Let's say if there is something which is related to it, okay, right? So let us say that what's the distance between Hyderabad and Delhi. It's a simple question. Just pick it up, and it's not there. That data is not available. Okay, so it'll just pick up Hyderabad.
Yeah.
Okay, and give you a random number. Okay, without saying that I don't know. And if you take that random number and use that as truth, you're in trouble. Okay, that's the problem with AI. And to be able to overcome all of those challenges and to build a model which is consistent is what's the real challenge in implementing AI.
Same thing happened with us also. We just went into ChatGPT and checked who is the best homeopathy doctor in Hyderabad. It has picked one doctor, and we did not figure out why it has picked this doctor. We again asked it. So how did you select this doctor? It has gave some set of criteria from where it has picked the data. Next day, what we have done, we have entered all our data into those websites, and it started picking us.
Oh, yeah.
Okay.
Yeah,
So,
that's a new area of search engine optimization,
Right,
which is
yeah.
generative AI optimization, right?
Yeah.
Because people are moving away from Google search and they're going towards Gen AI search, right? Gemini is, so if you look at Google now, Gemini is what comes up first. I don't know how many people are going below Gemini and going into the Google search. Okay.
Yeah.
People want bulleted, concise, precise information. They don't want to go through and research and look at 10 different sites and figure out and collate an opinion. They want somebody to give you an opinion.
Whether it is right or wrong, that's the next thing.
I want a summary.
Yeah.
I don't want, and if that summary looks okay to me, that's good enough. Correct?
Yeah.
So that's how we are. So that's why Twitter also really took off, because Twitter was this whole bulleted one point thing. And if you look at how media has moved in the last few years, everything has become this huge bulleted one point, very striking, very do you know what happened kind of a kind of messages which makes you want to click on that.
Yeah.
Okay, that's how the internet has been reduced to, and news has been reduced to that.
Yeah, you have given one best case for how you have implemented. Can you give me one best case where you have dropped the idea of implementing AI here so that it doesn't make sense?
Yeah, so multiple areas. So there is, I would not say we've dropped it, but we put it on hold because there is one where in which we had to do some annotations, some coding, and all of that stuff, and we were in the process of. So we initially took a timeline of 3 months to build the basic POC. Okay, 3 months were done, and we were still far away from anything which is usable. Okay, then we figured out that one is that it's a lot more complex than what we figured out. We don't have the technical capability. The people who have the technical capability are not able to, imagine AI and their functionality, their knowledge domain, how to marry both of that. Okay. The next one is that there are not enough standards in the industry to support AI being able to do that at 100% or even at an 80% scale. Okay, so which is where we figured out that this is not a good use case for using AI. Okay, at this point of time. Okay, we'll need to wait, or we need to revisit it later. So we've just kept that on hold, and there are a couple of examples.
Yeah, what was that exactly? Do you mind telling those details? What exactly was it?
So we were attempting to build SDTM data sets using AI. Okay, and we built C dash. That was pretty easy. But SDTM is much more involved than building C dash, than doing C dash annotations. SDTM involves a lot of, today it involves a lot of manual effort. So at this point of time, we've kept it on hold.
Can you explain what is that SDTM?
SDTM is Standardized Data Tabulation Model. It's a CDISC. CDISC is an organization which looks at data standards in clinical trials or in clinical research. Okay, so it's a way of representing data which can be submitted to the US FDA.
Okay.